Okay. I wonder why Deb is not able to hop on.
And we're live. All right. We need to check and make sure that each of the streaming services.
Okay.
Okay, Facebook's good. Okay, we're excited to be back, everybody. We've missed you all.
Hi.
We've had some lots going on, I think, the last couple months. I think that's just for everybody, now that I think about it all the way around. Just busy.
Cool. Yeah, I see now life is on Facebook. Okay.
So tonight we're going to talk about Ozempic and GLP-1s here on Cancer Conversations and Choices with myself, Marinette Smith. I am a registered nurse and holistic cancer coach. And joining me will to be Maya and Deborah. I'll let them introduce themselves, and then I'm going to just read off our disclaimer really quick. For our full disclaimer, please check out our YouTube page and below the video to be able to read all of that. But we just want to let you know that information on this podcast is for educational purposes only and for informational purposes only. If you do decide to take action from anything that you do here on this podcast, we do advise that is on your own. You're making your own choices, and we do advise that you work with a healthcare professional, a licensed healthcare professional. And anything that we say on this podcast should not be replaced for any healthcare advice.
Hi, everyone. Yeah.
Oh, go ahead. Yep.
Deb is coming in. Yeah. Hi, everyone. I'm Maya Saman. I'm holistic cancer coach, and Deborah is here too. You muted. You are muted.
Unmute.
Yeah.
Okay, for some reason I've hit it twice and it was the one unmute. My name's Deborah Herky and I'm a holistic cancer coach with beatcancer.org.
Okay. Who's gonna start? Like, we're talking about Ozempic today. It's such a hot topic.
It is.
Right? There's a lot of talk about it, controversial, talks, whether people should be on it or not to be on it. So we did a little digging, and we would like to share what we, our opinion on it and what we think about it.
There's a lot that we found, wasn't there, Maya?
Yeah, we did actually. We did. So let's just kind of have this brief what's GLP-1 is and what does it do what's the role of GLP-1 in our body. So GLP-1 is basically glucagon-like peptide, and it's a hormone our body produces naturally, especially after we eat, and it's regulate blood sugar levels, appetite control, and then digestive system. It plays a role in the digestive system because GLP-1 get produced in small intestine, in the digestive system. So it's basically endocrine hormone. So when we talk about GLP-1, you have to think about endocrine system and endocrine hormone. So and talk about Ozempic on entire endocrine system. When people have been introduced, to Ozempic, what exactly happening inside the body and what does it do? So anyone would like to go on with or
well, what we were just talking about too is prior to the show, like Maya was saying, the GLP-1 it's a hormone, it's a peptide. And
Right.
Peptides are pretty big. We're talking about them, and you hear them a lot right now. People are bringing them up. There's lots of different companies starting to promote peptides. But it's really important to know that our peptides work together, not individually as one, and our body is meant to work together with things. And so just really kind of taking those thoughts into consideration when we're talking about this and I think this goes for any supplement too. You're taking that one thing and you're concentrating it. really, if you're thinking about it, or making more of it, or getting more of it in your body than your body would. So that's one thing to kind of consider when we're talking about this. If you're already making that, in an adequate form, then really should you be adding anything else to it, or adding on even more to it. But on the other hand, if your body is lacking and having trouble with those certain chemicals in your body, or certain hormones, if you're having problems with making those on the first place, then is something like this an option, or are there other options out there besides just medication?
Right. Yes. Since we mentioned that peptides, we're not saying people should avoid completely peptides. There's probably a place where those peptides would be very useful and to use in the medicine, especially in the conditions. We have listened, Deb and I, when we were at the convention, whether Annie Appleseed or here at Beljanski, there were a couple of peptide presenters, and it seems very interesting. Right, that we were listening. It was very interesting to listen. There's a place to use the peptides in people, but when it comes to GLP-1, you have to understand like what's the difference between whole dose, microdosing, and then taking for life, basically. Because my understanding is GLP-1 was invented to be taken continuously until for the rest of your life. Because once people stop, then people gain weight, diabetes comes back.
So I can tell you, like when I was working in the healthcare field, a lot of the specialists, they would prescribe those, but the goal was to come off of them. So even though the saying may have been like, yeah, this might be a lifelong medication, really what the goal was is to be able to learn the skills that we need to be able to take care of ourselves, take care of our bodies, eating properly, balancing out our all those things, so you're not relying on that medication for the rest of your life. So I think that there's obviously different perspectives on it. But that is one thing that I noticed, like when we're hearing conversations like life medication, where did that come from? Because there are still providers that are saying like, no, you really should only be on this for a short period of time to try to help get things kick-started. So then that way you're learning those mindset changes, like the mindset shifts, to be able to eat differently, exercise, move your body. It's like that boost. But then there's the other side of things, like I said, there are people out there saying that you need to take it for the rest of your life, and really it should be one of those things. It's just like a tool.
Right.
A tool.
Exactly.
A tool for who? Sorry.
Yeah, tool for that's exactly. So I always think of like when we introduce something from outside, GLP-1, obviously Ozempic is a synthetic GLP-1. So when we introduce something synthetic, what happens inside our body? Because our body naturally makes GLP-1. So what exactly happens? So I kind of dive into that and looked into that, and it's actually our body get paralyzed producing its own GLP-1. So it stopped producing it. GLP-1 and the role of GLP-1, as I said, like it's it's involved in in pancreas. It signals the pancreas to release in releasing of insulin, and that's why many people are experiencing symptoms of pancreatitis when they are on Ozempic or any other GLP-1. And the biggest problem through my search I came across is like the dosaging of GLP-1, especially the doctors putting patients on, the dose is so high that it literally paralyzed, like it's it's shock to human body. They don't start at the lowest and they start at the highest dose and they keep increasing. And yeah, that is the biggest problem. That's where people experience like digestive system paralyzed, some organs, because it decreases the muscle mass and it decreases very fast. When it decreases the muscle mass very fast, there's no the contractions of the muscles, everything, our muscles contract to do the job, especially in digestive system. So it slows down and it causes like this paralyzation of the muscles, the remaining little muscles that the people have. And it causes a lot of problem. And now some studies have brought GLP-1 to thyroid cancer because it's endocrine. So endocrine hormone. So one of the risk of developing thyroid cancer. So that's another one. Pancreatitis. So the emptying the stomach because it slows down gastric, emptying the
Oh yeah,
You know,
so
the
slowing
food,
down the
yeah, that's
gastric,
another
the juices. So then it
gastric.
also starts affecting the gallbladder and the liver, correct? So then
Yes,
people are
yes,
starting to develop like gallstones, gallbladder issues, bile
exactly.
duct issues.
Right, right. So there's a lot of things involved but when people take GLP-1 and when people want to stop and when they decide to stop taking GLP-1, so they gain their weight back very fast. So instead of talking to people and telling people like, okay, start from changing your diet and exercising and your environment, the doctors keep telling them the food does not matter. Food does not play a role in your condition. Um, it's generic. So obesity and diabetes apparently is generic, and that's why you have to go on GLP-1. So I kind of went a little bit deeper into the research and I came across like there apparently a Harvard University professor, but her name is Fatima, what was her last name? Stanford, actually. She was a researcher on diabetes and obesity. And she was basically funded by pharmaceutical companies, especially Novo Nordisk. And Novo Nordisk actually the European company, and they don't prescribe in Europe Ozempic. So
Not at all.
It's basically
Mhm.
made for population of United States.
Yes.
That's where they get most of their money. It's from the United
That's
States.
where that's what they
Yeah.
get
We're a
their money
testing
from.
ground. We're a testing ground.
So the
They
people,
get our money from us, and
exactly. So people in the United States basically are guinea pigs.
yeah.
So
Yeah.
and then this professor Fatima Stanford apparently a board member of creating a food pyramid
Okay.
for for diabetic people and obese people, and she's the one who talks about that diabetes and obesity is in your genetics, it's not food related. So people have to think what they're
Yeah.
taking and what they're putting in their body, right?
Well, if you
So
think about that, I mean, it doesn't really make much sense, right? With we were talking about even recently, just the adulteration of our food. It's just so much different in what it's doing to our bodies. I mean, specifically, even like seed oils, I could say.
right.
So it's not like it's not the food. There's so much evidence to show that it is the food. So it's mind-boggling that can even that narrative could even be directed that way, I guess.
Right.
Well, and it's scary too, when you bring up Novo Nordisk, going back to that and the sheer fact that it's not even approved in Europe. Ozempic is not it's not even approved in Europe. So they won't give it to their own people, but yet they're making most of their money off of the United States.
Is it $20,000 for one dose? Is that right? The like
Something like
10?
Yeah.
It was tested for 6 to 8. It was tested for 6 to 8 weeks only, and then it was released to a public, to a doctor to use in the public. So and now people are been using for past couple of years, and then now all the side effects are popping up. Another major side effect is actually suicide.
Yeah.
Because of the
mental health. It's affecting
mental
health
health
a lot.
Yeah, a lot. Beside the digestive issues, pancreatitis, people are people have been dying within 3 to 4 weeks after doctor increased the doses of Ozempic.
And that's related to the serotonin levels.
Exactly.
Think,
Yeah.
right? With the digestive system, so involved with our serotonin creation.
Right. That is so true. So when people start, there's a lot of nausea, vomiting, fatigue, and headaches and indigestion when they just start. And my question for that is, does it worse like to go through all this stuff like vomiting, nausea? Because I've seen people, saying that, oh, this is from Ozempic, and continue taking that instead of just go ahead and changing their diet. And they never question like what is Ozempic, what's side effect, and how is that, what's the long run? And why do I have to take it for the rest of my life? Because it's been presented to them like you don't have to change your lifestyle, but you have to be on Ozempic for the rest of your life. Same thing as any other medication, basically. So that's like some kind of truth about like one of the Ozempic parts when people take it. And do you guys want to add anything? Like, let's see.
Yeah. So I was actually just gonna, because I have a couple of notes on here too. This is just really good information, I think, in general for just the public to know that most Americans have prediabetes, or 60% of adults, and 33% are children and teens. Like that's a lot. There's also now they're finding that 25% of teens have fatty liver disease, which is new to our generation, or this timeline, unfortunately. And so, like you were saying, let's see here. Let's see here. Oh, yeah, you already mentioned the drug was not allowed in Europe, right? And then the other thing is too, just, because this is something that people are starting to say that, oh yeah, we're using it, I'm losing weight, this and that. Just because it's common doesn't mean that it's good. Doesn't mean that it's good for you. So you really have to take, like Maya loves to say, you really need to do your own research when it comes to all of this. Because
Right.
it's pretty in depth. I can share with my own personal story. I had used actually Ozempic in a microdose for a year. I was actually struggling with metabolic syndrome, Cushing syndrome, and like obviously prediabetes after chemotherapy, and over a year's worth of steroids. I had gained 100 pounds. My endocrine system was just shot, and I just was having a hard time even losing weight, functioning at all. And so I was seeing a functional medicine doctor, and thankfully they were like, no, we don't start out at that very high dose like everybody else. You're going to do a microdosing. So I didn't experience a lot of these other symptoms that people did, and I didn't use it for very long. It was almost like it turned that key on for me, so that way my body could start getting rid of getting rid of things and being able to function. But I did have a lot, a little bit, I guess, of the nausea and stuff, but it wasn't ever presented to me by that doctor. This is going to be a lifelong thing. This was like, okay, you really need to look at the way you're eating, what you're eating, how you're eating, when you're eating, are you working out, are you moving your body? I mean, it was a full-on discussion of you're not going to be able to stay on this for the rest of your life or for an extended period of time. And so I'm wondering, how often does that actually happen when people are having these conversations about weight loss and their metabolic health and what's going on? And then the other thing is too is, are there any deeper dives going on? Are there HPA axis dysfunction symptoms or syndrome that people are dealing with that are not being looked at? Thyroid issues. Geez, there can be all sorts of genetic conditions. I mean, there's just so many different things. And so just maybe looking at this is like one of the last things that you would do if you were to look at a medication, because there's all sorts of natural and homeopathic and holistic ways to be able to also address this. So I guess I just wanted to share that a little bit, but yeah.
Yeah.
So it's interesting to with the information that's been provided so far, Ozempic started out semaglutide being administered or prescribed to people as a medication, and it was prescribed for mainly managing type 2 diabetes, and it was effective, very effective, and that's what it was used for. And so we're a trendy society, we just are, and that's what happens when we have something that works. Somebody else gets on and says, well, maybe I should try it if you're losing so much weight. And then that gets pushed. And what I'm trying to get at is that you talked about the data for teens being prescribed Ozempic, or a semaglutide derivative thereof, but we're talking primarily about Ozempic. That study was fast tracked. It took 68 weeks on a
68 weeks,
study
yeah.
to basically say that yes, you should start giving this to teens. 50% of the population almost is on Ozempic are teens, and they have to be on this for the rest of their life. Have to be. They don't have to be. Obviously, we have choices, but I mean, what I'm trying to get at is that that's what it is. It could, because if you do go off it, what happens? Your body doesn't know how to handle itself anymore after that because it's been given a synthetic drug that has been doing this for them. I think people also, to a certain degree, have to be very mindful about the fact that this is a drug. This is something that is affecting your gut, and it really causes a lot of gut dysfunction. And here we are trying to prevent gut dysfunction. We're trying to make it healthier and everything, but yet here we are being prescribed this drug, and it really causes a lot of issues outside of everything you're trying to fix. So it really kind of falls along the lines of kind of like you're not fixing it. It's actually creating a lot more issues with our bodies as we're looking and moving forward with that. But then also as well, we talked about the mental issues, the mental health disorders that are I have to stand up, sorry, for the mental health disorders that are happening as a result of that also. And the constipation, fatigue, dizziness, abdominal pain, the burping, the heartburn that you experience on Ozempic when you're taking it those are just your normal mild symptoms. And it progressively gets worse from there. And we can talk about that in a little bit as well. But it's interesting to me, again, like I said, that, we want people to get healthier and live fuller lives, but yet we seem to, as a society, our healthcare system, we're not really doing that. We're hindering rather than helping. It's something that is making money for individuals, companies, that is, again, kind of like the underlying push for all of this as well. And it's scary. And so hopefully, as we talk more about this, that people will really do their own due diligence and look into these products that are being administered are really, really important. You just don't take something because somebody says take it here, it's good. You really want to know how it's going to affect you. So and that was another thing that was touched upon as well, is what other drugs are you taking already to combat some of these other gut
issues
and or any other issues that you have that you're fighting. And here you're adding another one that, my goodness, if it's not even being allowed in Europe, take another look. You might want to wonder why that's not. And they're usually very, very strict about what they administer and what they open up. And so do we feel does it sound like we're kind of being guinea pigs when reading up on all that stuff? Yeah, absolutely. And comes a time when you kind of get tired of doing that.
But many people don't know those drugs are not allowed in Europe. But people don't know about it. And I want to add that when people deal with diabetes or obesity, most of the time, majority of time, they will have thyroid issues, the hormonal issues, because diabetes goes with everything, and adding endocrine, kind of a drug that targets your endocrine system to the already compromised, body, that is just takes off. It's like a domino effect. It's just gonna knock down one thing after another until people come to the point, either there's no way to turn back or, or they have to stop, taking this Ozempic and trying to rebuild their body. And our body, the way our body built is anything that comes, like any foreign substance in our body is going to reject it at first in many ways, and that should be a sign. Even like when they say, like, people might experience when I see these commercials on the TV or even on YouTube on Ozempic, it's like people are so happy going on Ozempic, but then down the road they start talking about all this like, side effects of Ozempic. But the whole commercial is like people so excited. It's like they win the lottery in their hands by going on this Ozempic without even thinking all this side effect. If the drug comes with side effect, even nausea, vomiting, that's not normal. That's not normal. You should not experience that, because when you eat your egg or you drink your milk or whatever, you don't experience like nausea, vomiting, or anything like that from the food you eat. Why do you have to experience those side effects? And that considered to be normal to experience those side effects. Oh, it's okay. It's from Ozempic. It's from my
But if
medical.
Well, unless you
That's
drink
okay.
milk,
that's like
unless
why
you
you're not
drink
eating,
milk.
right?
Yeah, I was
Huh?
gonna say unless you drink milk, you're lactose intolerant. Then you
Right.
Yeah,
Yeah. I'm
there's
just like, I'm just saying because that the thing just came to my mind. Unless you eat your salad or anything
Right.
like that's what I'm saying.
Yeah.
Like, people don't experience the nausea, vomiting because it's not normal. We should not
Yeah.
experience those things. And here we go, we take a drug, and the doctors say you might experience slight fever, you might experience like nausea, vomiting, diarrhea. That's normal. It will go away. So
It's just
since
not
when
normal.
those things became normal to our
Mhm.
society? Since when the being diabetic is normal? Since when being obese is normal and it's related to our genes?
Yeah.
And we don't think about it. We don't question those things.
Mhm.
And
I just think it's really interesting. You guys are like pointing this out. Like one thing I just want to mention, the way that the medication was originally supposed to be, for diabetic patients, pre-diabetic patients, not
Yeah.
that strong. Those are those strong doses that people are taking for weight loss. It's
Mhm.
not how it was initially intended to be used. So
Right.
I'll use even my example just because I can, give reasons. So for myself, I didn't notice any weight loss when I was taking it. It was just balancing out my sugars enough. And I can't remember what action it is. I had like had an overdrive where because of the steroids where I was just constantly hungry, hungry, hungry. And it shut that off. But come to find out, there's also natural products that you can use for that. But I think that that's just really good point is where you could take something that was it's probably not maybe the greatest first place, but something that was supposed to be to help somebody with a chronic condition, and then it's just taken and adulterated and used in excess. And so people are seriously having major health issues because of it. And it's just one of those things where it was initially maybe you shouldn't have been using it at high doses. And people are found, oh, I can lose weight and I can, if I use it at this high a dose, then I can just drop all the pounds and not have to go work out or change the way I'm eating or, it's very
Right.
appealing that way, especially when we're in such a busy um, culture and stressful culture. It's like, oh, okay, well, I don't have time to worry about my diet or my health, working out. And it's so confusing. I mean, it really is. And that's
Yeah.
why I think you really need people to guide you. But I think that's just a really good example, like I was saying, something that was intended to be used for a certain purpose, and it's completely lost its purpose.
Yeah. Some practitioners in the functional medicine world, they do talk about microdosing with Ozempic,
Mhm.
and they're stating that their statement is like it does work on people, but I had listened to a couple of them, and they do talk about they would not prescribe to their patients or client unless the patients do like dietary changes or lifestyle changes. So they won't prescribe microdosing. Maybe in those cases, it does, kind of does give body some sort of effect on microdosing. Maybe, diabetes is worse than taking Ozempic because it damages the cell, you know,
Yeah.
cell in the body. Diabetes, maybe it does worse taking, but I'm always like me personally, I'm always so skeptic because of our mentor Andrea. She always like, she makes me always think like, microdosing. So if Ozempic is so like, I mean, it's toxic, it's still synthetic, right? So if it's like, do you really want to add something synthetic to your body every single day in a microdosing and hoping to get better, right? Or hoping to me, it's like it's still poison. do you really want to add the poison to your body every day? But that's like, that's another kind of way of looking at. That's the way I look at it. Like, would I really want to add a poison to my body in a microdosing level, on a microdosing level? It still affects your GLP though, right? It still affects it. So there has to be a more natural way you can activate your GLP so to reduce the insulin levels. And one of those ways is like to cut down on the food that creates diabetes in the first place. Looking at your diet and your lifestyle. But in our society, we're programmed that we want everything so fast. We want everything happen overnight. And we want to lose weight overnight. We want to become healthy overnight. We want to do everything overnight. So, and that's what I think the system is buying people with. It's like by stating that you cannot do anything yourself. You don't have to change your diet, and it's in your genes. And this is going to be very fast.
Taking away autonomy.
Yes, yes. I think that's what the whole thing, like the system is buying it, because people really don't want to work on themselves. They just don't want to. And a lot of people just would be willing to do that instead of changing their lifestyle and their diet. You
I'd
just
rather take the risk.
they would take a risk of, like, I know
That's a
people
choice.
like that.
Certainly
Yeah,
that's a choice.
I would enjoy my life, but I would just do that. I like it this way. That's fine, But always, even though this way of doing this way, you still have to talk to your doctor and do cautiously, than taking like a high doses of it at
Mhm.
once, from start up and destroying your system.
Yeah.
Yeah. So the way I think is Ozempic is toxic because it's synthetic. It's takes off balance so many organs in the body. Plus, you don't change your diet. You don't change your lifestyle. What are you winning? My question is, what are you winning? What are you going to? You're
Mhm.
not doing anything. You're just expediting, I think, your condition to go worse, even faster than it would have done without Ozempic. This is how I think.
Because it's kind
Well,
of the same.
and then you have
Go
to
ahead.
think about the long-term effects. I'm sorry.
Yeah.
Think
Go
about the
ahead, you go
long-term
ahead.
effects of that. The long-term effects of being on a medication that, when, yeah, you're right, Maya. When, you could look at things. The thing that keeps popping into my mind again is also it's the sugars. When you have everything that we eat, that is, when you walk in the store and everything is just sugar. Sugar related. That's just our society. That's what we live in, and it's really hard to break that. I'll be the first one to, admit it's hard. And if I have anything stressful that's happening in my life, oh yeah, I'm gonna go for a cookie.
Yeah.
I'm gonna go for this. I'm gonna go for that. And there are times when it becomes so overwhelming, you just don't care, and you're just gonna eat it, and then you regret it, and like, okay, now how can I reverse that? Well, sometimes you get to a point then where there is no reversing it. So then what do you do?
Yeah.
And you don't want to get to that point. And I think that's why we're trying to, educate people as much as we can that it is as difficult as it may be to make those changes. But that's why we're here. We're here to help. We're here to, coach, guide, suggest, and help in any way as far as that goes. But it really truly is it's a deep down transformation, and in making, those life altering decisions. And sometimes you have life altering things that happen,
Right.
and you are forced to make those decisions. And you certainly don't want to be in that position either. But sometimes I swear it's a blessing. As much as I hate to say it, sometimes it is a blessing, and it's an eye opener. And
Yeah. Yeah.
Sure.
I'm reading my notes here. The reality check on Ozempic, it claims to be a weight loss. Now they're using it for the weight loss. It started for diabetes. So the crucial insights of it is often comes with muscle loss, nutrient depletion, digestive disruption, So, and the weight comes back once the drug stops. Appetite suppressor, so can lead to undereating, malnutrition, and eating disorders. Okay. Blood sugar control comes at the cost of gut paralysis, gallbladder dysfunction, and pancreatic stress or pancreatitis, and even more serious pancreatic issues. Yeah, it's actually lowers the secretion of pancreatic enzymes. That's another thing about it.
Yeah.
Yeah. So
And that's a huge deal, right?
it's a huge
Can you
deal,
explain
right?
why, just for the viewers that don't know what that means, the pancreatic enzymes?
Pancreatic enzymes, yeah.
Is what happens.
Right. I mean, that's mean the food does not get digested right because the pancreas does not release proper enzymes, and the same thing, gallbladder cannot secrete like a bile. That's another thing. So heart protection. So based on limited studies, it says here, its specific population often with conflicts of interest. But when you think of our digestive system is a door basically to many health conditions, you could say like when your digestive system is having problem, your pancreas having problem to release the enzymes, and gallbladder release the bile. And we all know bile detoxifies hormones from our body, excess hormones from our body. So when the gallbladder, there's no secretion of the bile. So that's mean there's a risk of getting breast cancer. Actually, I read somewhere that Ozempic linked to breast cancer. So by thinking this way, improves metabolic markers, but can occur with fasting, real food, and natural lifestyle. You know, you can improve your metabolic markers, which you cannot do that without being on Ozempic. You cannot improve your metabolic markers. That is such a big lie. You cannot do that.
It's always going to still be off because there's still a synthetic version that's still being supplemented.
Right.
Until your body creating it itself.
Yeah. It's a pharmaceutical drug that mimics your natural GLP-1, mimics. So it doesn't work. When it mimics, that doesn't mean it does not do a job what our body intend to do. So yeah, by thinking there's so many things like underlying the cause of it, that the people became literally people became guinea pigs of the pharmaceutical companies. They testing on people because 6 to 8 weeks testing is not enough. And now they're talking to give it to children with type 2 diabetes, prescribing to children Ozempic. This is just insane to me.
What's even more insane too is, well, no, that anything that's going to affect children, I'm sorry, that's just criminal to the nth degree, but is also the, the tachycardia implications that it causes as well. So I'm curious, when you order this, because it's available over the counter now, who's monitoring you, and how do you know that you don't have a heart condition? And of course, this hits really close to home right now for me. So yeah, I really have a problem with being able to order this online at different, different levels that you can get, and you're not monitored. And how do you know how your heart is? When was the last time? Who has their heart checked? I mean, really?
Before they start the GLP-1, right?
Like,
I mean, how often?
I'm healthy. I'm good. Don't seem to have any outward appearance, any signs of anything. And yet, when you're taking this, and let's say you've been on it for a year, yeah, everything's going good, but maybe it's not. And it's just very scary. It's very scary.
There's actually a vision loss on Ozempic. People have been reported a vision loss due to ocular neuropathy. They've been reporting that. And then there's actually a bowel obstruction due to paralysis of the intestine, and death. It's been reported death. And we all know, like by law, if there's more than 2 people die from the pharmaceutical drugs, they have to take the drug off of the market, which does not happen.
Mind-blowing.
Yes, they have to
Absolutely
take it off.
mind-blowing.
Yeah, and there's been reported of fatalities being on Ozempic, and especially increasing the dose of Ozempic, the fatalities happens very fast, within like about
Yeah.
4 weeks.
Well,
Yeah,
and if you think about it, people are getting dehydrated because they're not eating enough, they're not drinking as much as they should. And I want to touch on really quick the paralysis, the gut paralysis, because I think originally, from I know my perspective as as a nurse, it was just listed in there that it could be like a temporary paralysis. Come to find out, it could be a permanent paralysis. But the other thing is too, people don't realize like gastroparesis, like what that is and how many
Yeah.
issues that can cause. And that can be a lifelong problem that you can have too, especially if you don't address certain things in your body to be able to
yeah,
reverse that.
yeah.
And so there's all these other things that are not discussed as much.
No.
And it's kind of unbelievable.
I don't
50% of people have gastric issues with the medication. So
right. Well,
Well, you know,
I
and
guess
Yeah,
sorry,
go
go
ahead.
ahead. The gastroparesis is basically when the condition when the stomach cannot empty itself. And it brings it to nausea, vomiting, and the paralysis happens, right? Because the muscles are not functioning, right? So, and that's been happening a lot with Ozempic. That's, I think, one of the biggest issues in Ozempic, in people taking Ozempic. So that's a gastroparesis. So the thing is, like, the symptom side effect happens faster than reversing the condition. It takes longer to reverse the condition. In many cases, it's hard even to reverse the conditions. Yeah, it's very, very things. I don't want to, I mean, like, I don't want to rely all the symptoms and side effects to microdosing the with Ozempic, because my microdosing are different. I know some, like I mentioned, functional medicine do use them. But with a regular dose of Ozempic, there's a lot of side effects.
Yep.
Well,
and
and you
that is
have
the
to wonder
difference
too,
between
are they being monitored by a physician? If they're not being
Yeah.
monitored, physician, like I said, I've got an order coming in tomorrow. I don't, but saying I do, I'm, no one's monitoring me. No one is monitoring anybody, as
Right.
far as that goes. And that's really scary. And who knows what underlying conditions you have. Obviously, if you're taking and being prescribed Ozempic, there's other things going on, right?
Right.
What are those other things, Marinette, that you had just brought up that aren't even discussed? Because it's, because really, how much time do you spend with your physician? How in depth of a history do they go through with you on your medical history? This is what happened from point A to point B till now. And are they actually looking at that? They're pretty busy coming in with their little iPad and doing all their stuff. I'm like, okay, we got this one. We're just going to do that. Now, look, am I trying to bash? No, I am, and I'm not. I love our nurses and our doctors and such, but I think they're allowed not to be able to do what it is that they would really be intended to do. And that's a whole other conversation. And I don't want to go there. But what I guess what I'm trying to say is there needs to be more care, more time afforded to individuals, because then again, if you can just order it online,
Yeah.
you can be able to order anything and whatnot, and then people wonder, I'm like, well, I can't believe I feel this way. I can't believe this is happening. Well, hopefully we can probably shed some light on that, and we won't have it that much.
Well, I guess we could just talk too about like the things that we can do. Yeah, I guess the things that we can do that we have all done that have made such a huge difference. Because like we don't go to those medications to do what we're doing. And I think this touches on gut dysbiosis too, like in SIBO and all those other things, because if you have all that stuff, you're gonna have trouble losing weight anyways. So if you're not really addressing your gut in the first place, you're just going to compile onto it. You're just going to make things worse down the road. And it's going to be harder as you're trying to fix that new issue, years down the road. But
right.
Some of the things like, what am I trying to think of, Maya? And Deb, the mucus, the overgrowth. I lost the name of it.
Candida?
Kind of the candida, but it's also the mucosal, like the overgrowth, the bacterial overgrowth that you can start having.
In your the lining, the gut lining, is that what you're talking about?
Yeah, so that can also add into and feed like like it's a carb. Those bacteria really want those carbs, and so you start craving them. And so getting
Right.
rid of the sugars that you can be able to help
Yeah.
calm all that back down
Right.
is super important.
Right. GLP actually in our body naturally reacts to carbs and to fat. Not as much to protein. I mean, it probably does, but the mostly to carbs and fat, right? But when people start Ozempic, there's a big issue as I mentioned, like with gallbladder and pancreas, secretion of the bile, secretion of other things. So when people take Ozempic, they think they're saving their life from diabetes to becoming like a diabetic or or losing weight. Now it's trendy for losing weight, but when they hit the wall with Ozempic because they start developing other issues, other health conditions. And it's not one condition though, it comes in a package of conditions, mostly like a lot of gallbladder.
It's a bundle pack.
It's a bundle pack. Yeah, you get Ozempic and you get other stuff for free. Basically, you get for free like a gallbladder issue, pancreatitis, like a blindness, digestive issues. You get this entire bundle for free. Like people lose their vision. You cannot reverse your vision. People lose their gallbladders. A lot of gallbladder surgeries in people who take Ozempic. So we know when people lose their gallbladder, they completely become hormonal dysfunction. And on the top of being hormonal dysfunction by taking Ozempic. There's so many issues that people have to reverse back, stopping Ozempic. And the sad part is when the doctors offer their client or prescribe their patients taking Ozempic, they never talk about side effects. They never they don't talk about outcomes, what's going to be. I don't think so they even know about stuff like that. To tell their care, okay, you know what, I can give you Ozempic, but you have to know this and this and that is going to happen to you. And you have to make a decision whether you want to go on Ozempic or not. Because I have actually even relatives like calling me and asking me, Maya, what do you think if I start Ozempic just to motivate me to lose weight? I'm like, what kind of motivation are you going to get from Ozempic to lose weight? You know what I'm saying? You still like gonna eat the food you eat because that's the whole purpose of Ozempic, because you eat what you want to eat and you take Ozempic for the rest of your life. You don't change your diet, you don't change your lifestyle.
I think, and you hit it pretty good there. I would hope beyond all hope that that medical professionals are giving the side effects and the of what could possibly happen. I know that when you get vaccines and you're a mom, you go in and I said, oh well, here's your sheet of paper to read about what happens, the side effects of what can happen within the next 24 hours. They don't tell you what can happen with the rest of the life of when you do get that. But how many people actually read that sheet of paper? I'm going to tell you right now, I folded it up and I would toss it. I would never read
I would read it out to my patients every time.
See, no, that's awesome.
I just couldn't do it. I couldn't do it. Like I would feel too guilty. Like I couldn't give them this medication or this injection without them actually understanding. And like you do understand what they're getting. Like, okay, so we're gonna sign away. But a lot of people don't do that. A lot of people
I didn't.
Yeah, I didn't. Here's some side effects. Here's a sheet of paper. Here you go.
Yeah,
it really depends on the person of who you get to care for you.
Yeah,
but they usually give you basics. Yeah.
Yes. And then the impetus then is on me to take this piece of paper home and read it. But does it really give us everything? No. But to do your exactly. But to do ask questions when you go to your provider and you have any sort of ask the questions, and they may be hard questions, but you know what? That's why they're there, and that's why you're paying them. Don't forget that. And if you need help, if you want guidance, if you want, I just suggested to somebody, I said, I'll be there, just Zoom me, FaceTime me, I'll be there. I can't, if I can't be there physically, I said, just FaceTime me. And, I can be there and listen and be that other set of ears to be able to help, well, maybe we'll ask this question or to ask that question. And I've done that, a few times in the last couple weeks with some folks. And it's, ask the questions. That's why they're there. And if they can't answer the question, they should at least say, you know what? I'm going to find out for you and I'm going to get back to you. And if you don't hear from them in a reasonable amount of time, then maybe you either call and say, hey, look, or I think I need to find someone else because, the number one, they don't have time or they just don't know
Yeah.
the answer. And, but definitely ask the questions. And I've told my son this when he was in school. I said, don't ever be afraid to be curious and don't ever be afraid to ask those questions. I said, because that's how you learn and that's how
Yeah.
you get educated. And you never know, you may be educating that person too. You never know. And it's not it's not a, you're being ornery and you're not being like, no, Marinette's probably going, oh yeah, it is.
Yeah. Yeah.
Like, well, I don't have that doctor anymore because I thought I was being combative. I'm like, well, you know what? Then maybe you just shouldn't be with them.
Yeah.
Bottom line.
I actually I listened also to Brian Ardis show. He was talking about Ozempic, and he actually mentioned that the ingredients of Ozempic is very dangerous, and that probably would know what I'm talking about because we were at
It's
the
not snake
conference.
oil.
It's not snake. Are you sure it's not snake oil? And it's not snake venom.
Snake venom, actually, the part of Ozempic is like a snake venom. That's another thing.
Mhm.
So, and which is altered DNA.
Yes.
It's another thing, and activates the spike proteins in the body. That's another way. So there's a lot to talk, but that's another show talking about Dr. Ardis and his talk. And I don't know, Annette, are you checking social media if there's any like questions or
I
if
have been.
people
I haven't seen any
have-
yet. So
Okay.
one thing I think we should talk about, because I'm sure people are wondering, is like, what can they do? What can you use at home? What is safe? What can we do to lose weight safely without adding in a synthetic medication? Like I've talked before, I've used cinnamon, I've used berberine on a daily basis for an extended period of time. Come to find out, obviously, a lot of us are low in vitamin D, and that also has a huge impact on your hormone production and then management and throughout your whole body. So if you are low in vitamin D, take a look at that. Functional medicine labs compared to allopathic medicine labs levels are different. I can tell you from my personal experience that if I follow allopathic levels for vitamin D, I am trash. If I go with functional medicine level labs, then I get my labs up, my vitamin D up. I am functional and I feel amazing. And that's another thing that people, don't really know to do is to get that vitamin D checked and then make sure that it is actually an optimal level. So for like functional medicine, their minimal is 50. And so I think for allopathic, it's like 36 or 30 or 32 or something
Right.
like that. So it's a lot lower.
A lot
Which makes
lower,
a
yeah.
huge difference in your body.
Right.
So some of those things, what else is there? Yeah, those are three things I can think of off the top of my head. What else you can?
It's as we say, like you gotta clean up the muddy water. Like Kara Mintz was saying, like if you have a dirty aquarium, instead of cleaning up your aquarium, you're giving the fish drugs, to get better. So that's exactly what we have to do. We gotta clean up the environment. We gotta clean up our body. We gotta clean ourselves up. I'm diabetic. Okay, what do I do not to take Ozempic or any
Yes,
other
please
drugs?
tell us.
Right? What do? I basically don't put the oil in the fire, which means that I don't put carbohydrates in my body. That causes blood sugar spike. Some people would say, okay, it's hard to do so, but if you then implement exercising, exercise should not be like crazy activity 3 times a week even. It's still like if you do 40-45 minutes, implement like weight exercises. That's another way because your muscles would use the glucose as a source of energy. That's another way. Even sitting, when you sit, you can do exercises. That doesn't mean like, at your desk, you can do exercises. So sleep, most important part, because we know how during sleep our body balances the hormones and releases the insulin to balance blood glucose levels. exposed to sunlight, grounding, everything. Grounding, actually, I just learned that grounding is actually increases the glutathione levels in your body. That's the most important oxidant, grounding.
It's
instead,
actually the best, isn't
it's
it?
actually the
think it's
best
actually
way
the
of
best.
increasing the glutathione in your body.
Yeah.
Is just go and put your feet down on the ground for 15 minutes.
Yeah.
You're gonna get best glutathione instead of taking supplements of glutathione.
The best way to
Power nap.
combat time zone when you're traveling too. You
Right.
just-
Yeah.
yeah,
That's a good
when you
tip.
land, give it start. Grounding.
Yeah.
Uh-huh.
Yeah. Find that 15 minutes a day for yourself. Do those things. Trust me, it's worth what you do instead of feeling miserable and being nauseated. I mean, vomiting and
Right.
nauseated, cannot
Yeah.
eat, not having appetite and stuff like that. It's
Yeah.
like, so just learn what you do, learn your steps, and work with someone who can guide
Yeah,
you in the right way. Yeah.
Yep. I know for me,
Yeah.
what the biggest thing for me is actually probably exercise and cutting out the sugars, the carbs, all those.
Yeah.
You
Yeah.
know, and and it doesn't. So have goals, set goals. Doesn't mean hey, tomorrow it's like that's it. You're cutting this, and this, and this, and let's see what happens. Well, guess what?
Right.
Did you know that a sugar crash is about as is the equivalent of coming down off heroin?
Yeah, it's even
Oh, that's a
I've
good-
heard
that's a
I've heard
really
even
good-
worse. Yeah, I've heard
Yes.
even worse.
Yeah.
I just
And-
want to, go ahead.
Wow.
So I mean, it's truly a drug. I mean, it
Yeah,
really
it is
really
drug.
is a drug, and it's it's one of the ones that I get this. I thought this was interesting too. Food stamps. You can buy soda. One of the only
Yes.
countries that you food stamps, and you can buy soda products with it. Soda, pop, whatever. And
Right.
they don't get
I'm gonna
psych-
add.
Because
It's $10
Coca-Cola
billion a
gets
year in food stamps. So it's 10% of the funding that goes to soda, and it's $10 billion per year that's spent on
Wow.
soda. And
$1
That's
billion a
crazy.
year. They get paid.
Wow.
Goes to soda. Unbelievable. I mean, it just
Unbelievable.
That's our
Only
second
United States, yeah.
Soda.
Soda. It would cover soda. I remember when my daughter was working at Whole Food, they would say like the food stamps would not cover a food, from bar. At Whole
Oh,
Food,
the
if
hot
people
food and the cold
hot
bar?
food in the bar, yeah, the food stamps won't cover that because that would consider like, I don't know, food, but they cover Coca-Cola. This is just like crazy. So yeah, the bottom line is to understand that food does not own you. You own food. You can make your decision. You can
And baby steps. Do it in
Baby
baby steps.
steps.
Like I said,
Yeah.
set your goals and say, okay, this week I'm gonna, instead of 3 sodas a day, I'm gonna do 1.
Yeah.
Start with that.
Things like that. Really.
And then just see what happens. Do that and just see what happens. And then next thing you know, exercise. And exercise doesn't mean go out and run a marathon, doesn't mean go out and run a 10K, and it doesn't mean to go out and run a 5K, although that would be really good. But it doesn't mean to do that. It just walk around the block, walk to the end of your driveway and back if you don't exercise. It's movement. It's getting that lymphatic system moving so you can drain all the toxins. It's, being outside, so you're doing a number of things. You're getting your vitamin D, hopefully, if you're in an area that has some sunshine and stuff. You're getting that, but you're cardiovascular, you're breathing, you're just getting out. And I'd be curious to see and start journaling. Start writing things down and seeing how you feel when you wake up in the morning. What does that look like? And just kind of start jotting those things down and noticing a change. And I think that's the problem too, is we want instant. I want to see results. I want to see. That's why I think I like mowing the lawn. I like painting a room. Painting a room because I can see like, oh, it's coming together. It's like actually seeing.
Right.
And I have to learn to be very, very patient. I have to learn to be patient with myself and not, when it comes to being overwhelmed, and this is kind of a mental health thing too. Journaling is really good. Spiritual, however spiritual you are, is connecting. One with the higher power, and then also and with yourself and giving yourself grace.
Yeah.
hugely important.
Remember, diabetes or obesity is not deficiency of Ozempic in your body.
Yeah.
Right.
So good. Such a good
Okay.
conversation tonight, everybody. Thank you.
Yeah. Yeah,
Always good.
that was
All
awesome.
right. Well, I'm going to end the show. Thanks for joining us. We will see you next week.
Bye, everyone.
Bye, everybody. Thank you.
Thank you. Okay.